I trained in India, in medical school in India, and I came here to do my specialist training in psychiatry. And then I did my master's in public health and leadership at Manchester Business School. And currently, I'm working for Signet Healthcare, which is the largest provider of independent mental health care in this country. I work as a consultant psychiatrist and divisional medical director for the south of England. And the reason I got really fascinated with Mirella and her team is I happened to attend, I do remember my first chat with Mirella. This was a interview scheduled on a Saturday. And I was wondering, oh my God, interview on a Saturday. And that's exactly when that weekend was exactly the weekend I booked my holiday. So I was in Istanbul with a couple of my friends, and the interview was scheduled at 10 o'clock. And I was waiting, 10 o'clock sharp. So I told my friends, to go to a particular place we wanted to visit that day. I said, you go ahead, I'll follow you because I've got some work to do. And 10 o'clock, I was waiting for Mirella's call. And then 10:02, I rang Mirella, and I really liked her honesty. She said, oh my God, Sami, I didn't realize that this was booked on a Saturday. But not to worry, I'll call you back in 5 minutes. And I was like, I felt bad. I said, Mirella, it's okay. It's weekend. I completely understand. We can chat another day. And she said, no, that's fine. I'll call you back in 5 minutes. And she called me back in 5 minutes. And, we had a chat maybe for 10, 15 minutes. And that's it. I signed up to her event. I had to take, that Friday off. Previously it wasn't. That for doctors, it's so difficult to reschedule our diaries. We'll have to go through 1,001 reasons for that. And the reason I had to go out now, actually, I'm on a hospital visit, which is very close, which is just half an hour from here. So I told my boss, let me go to this meeting, and then, I'll come back to the hospital in the afternoon. And you can see that he had called me 3 times. Is the meeting still going on? What is this meeting about? What is this women's club about? They're getting curious because, my board, I'm the only woman. So they are a bit curious. I've never seen her go for any non-clinical, conference or summit. What is going on? There's a change in her behavior. Yeah. So they're like, so maybe, probably it's perimenopausal. Do you know what I mean? That's what the men say. So it's really fascinating, and I really enjoyed the summit. And that gave me an opportunity to discuss my startup. So I'm working on an app and a digital platform for mental health. You would have seen lots of digital platforms for, therapy, holistic therapy, psychotherapy, CBT, psychodynamic therapy. But the biggest gap, not just in the UK, but, globally, is the waiting time to see a specialist. First of all, I need to know if there is a problem. Only if there is a problem, then I need to go and see a therapist. And then if there is a problem, what is the problem? What is the diagnosis? So then I can get the right level of therapy from the right therapist. So that's what this app is focusing on. This will be a global app. So this is not just for, UK. And this app is developed by a group of clinical experts, scientific experts from all over the world. So this is a big project. And I was in crossroads because I'm already in a senior position. So my friends were like, are you crazy? Why do you want to leave this role and go and start some app? That's not for you. That's for these, young people out of universities. So I've taken it as a challenge, and I'm hoping that, I will succeed in this app. And if there are anyone, who are providing therapy, please do share your details with me, because we will be linking, you guys through our platform for our patients. And I just happened to see, the horses, Wendy's, brochure there in my table, and I was curious, because I said, I'll take this to the hospital, and I'm going to, because we talk a lot about, different types of therapy, but pet therapy is, little explored in mental health. And I know that, it makes a huge difference to patients suffering from mental illness. So I've already taken a couple of your brochures, Wendy, to take it to the hospital on my way. Thank you so much. Thank you.